Caring people make the difference at American Senior Communities. Click on the American Senior Communities logo or go to ascseniorcare.com for information about services, locations, and special stories of seniors.
Welcome back. This is Caregiver Crossing on 93 WIBC. We continue our conversation with Doctors Mary Grace Pennella of Stillpoint Family Chiropractic and also Brian McCarley of McCarley Chiropractic. And before we left you, we were talking about just about all of us and what our needs are when it comes to our back and neck problems. And we hear from time to time about chiropractors adjusting babies. And babies don't typically complain of back pain. So, Dr. McCarley, why would we adjust babies?
That's a great question. It really comes back to the understanding of what chiropractic is really all about. If your paradigm of chiropractic is really about back pain, then it wouldn't make sense to adjust babies. But when you understand that chiropractic is really about making sure that the nervous system, which is the master control system of the body, is functioning at its fullest and communicating properly with the body, then you understand that it's important for that system to be clear from interference, even with babies. And one of the most traumatic things that most of us will ever experience in our life from a physical perspective is the act of being born, whether it's through a natural birth or even through cesarean. They're both very traumatic things for the baby. And one of the most important things that we can do is to check those babies for subluxation from the very beginning, because if their nervous system is not functioning properly, the rest of their systems won't function properly, and it's important for them to be functioning at their best while they grow. The analogy of a tree that's tied to one side is a great example. If we leave a tree tied to one side and allow it to continue to grow, it will grow bent. The idea is we want to clear that out and clear out that interference and let that child grow up in the absolute best way they possibly can.
It's so interesting. I had no idea that you did this with children, with little babies.
Absolutely. A number of our colleagues who have had children recently, actually, it's been great to hear them tell the stories about checking their newborns for subluxation right in the delivery room, which is really kind of neat. They check them, and if they need to be adjusted, then they deliver an adjustment there. And since we're on this topic, if I can, one of the things that I think concerns people, especially parents, about getting their children checked by a chiropractor is what they've heard about chiropractic from the popping and cracking standpoint. And it's important for people to understand that when we adjust an infant especially, the amount of pressure that we use to move their little vertebrae is about equivalent to what you could comfortably put on your own eye. So if you take your finger and press on your closed eyeball, don't press any harder than you don't want to make it hurt, obviously. And that's the amount of pressure we use to adjust a newborn. It's very, very gentle. Their little bones move very, very easily, and they respond exceptionally well. So it's a lot of fun to see babies.
I wonder why all babies aren't checked in the minute they're born.
It's just, again, from that education point of view. We talk about making sure that everybody understands how vital having a free communicating nervous system is, and who better from birth to have a free system that works perfectly. Their whole jobs as babies are to eat, sleep, poop, and grow. And if you interfere with any one of those, you're going to have, one, a cranky baby, two, a child who doesn't feel well, and as they grow, possibly one who has, illnesses that they don't necessarily need to have. Can I tell you a quick story then?
Yeah.
I had been taking care of a pregnant mom for her whole pregnancy. This is her third child, and she was just so delighted with her care during during her pregnancy. And last week she delivered, and she called us, and she had an appointment scheduled for yesterday. And she said, "Oh, don't worry, I'll be in with it, and I'm bringing Ivy with me." And I'm like so excited. So yesterday we had a 6-day-old baby come into the office. And,
oh my!
And it's so great because I had a couple of senior citizens who were there at the same time, and they just assumed mom was going to get adjusted and baby would stay in the carrier. And and mom was very clear. Oh no, she's getting her first exam and her first adjustment if she needs it.
Wow.
So she was a little bit fussy. We woke her up to check her, and, we check some reflexes, and we always make sure that everything's working properly from the neurology we're working with. And I kind of got her a little agitated. She was a little cranky. And what we found was the atlas needed to be adjusted. Now, your atlas is C1, or the top vertebra right underneath your skull.
Okay.
And it's the most vulnerable during that birth process. And so we found that on the left side, it was a little misplaced. And again, like Brian said, you just put the little bit of pressure on it, and I kind of wiggled it a little bit. The next thing you know, she fell asleep.
Oh,
and I think that was so fun and the mom had invited the other two women to watch the adjustment, and the two older women were looking on, how'd that happen?
That's great. Magic.
So, yeah, it's magic. That's chiropractic magic.
Right, it's chiropractic magic. That is our guest, Dr. Mary Grace Pennella of Stillpoint Family Practice, along with Dr. Brian McCarley of McCarley Chiropractic. And since we're talking about all ages and baby boomers, we mentioned our senior citizens, they're finding themselves caring for their aging parents and are trying to balance that with taking better care of themselves. So what does chiropractic have to offer this segment of the population? And I'm talking about the caregivers. Brian, doctor.
Sure. Yes. Can I tell a story again?
Sure you can. You can tell a story.
Personal story.
Sure you can.
I, through high school and college, watched my parents, both of my parents, work with their mothers who had two different forms of dementia. One was Alzheimer's. The other was originally thought to be Alzheimer's, turned out to be what was called Lewy body syndrome. And that was very, very challenging on my folks. And so having watched what my parents went through, and their tendency is, and I think a lot of caregivers fall into this category, is they tend to not take care of themselves because they're taking care of their loved one.
That's true.
And so what we look to do is to say, look, we understand where you're coming from. We want to help, and we want to be a part of that to help you take care of yourself, because the healthier you are, the better you function, the better you're going to be capable of taking best care possible of your loved one. And we want to be a part of that and provide some solutions for that. Everything from exercise and nutritional counseling, things like that, to chiropractic care and making sure their nervous system is functioning at its best and they're able to deal with the stresses that come with being a caregiver as best they possibly can, so their health does not begin to suffer. Because if they become sick, then who takes care of their loved one?
Yeah.
So that's really where it fits in for your audience.
Well, and now which we keep talking, wellness is that buzzword that we keep talking about or hearing so much about. That and chiropractic care, I think we're learning, has a great deal to do with wellness of all generations. We're learning about babies and even senior citizens. Dr. Pennella, how safe is chiropractic care for senior citizens?
Oh, absolutely. It is safe for every age. Now, obviously, if we can adjust an infant, there's no reason why we can't have the same gentle touch with someone whose bones may be a bit brittle. There are, just a point of order, there are over 200 different techniques in chiropractic. Some of them are very physical techniques, which you'd see someone use on an athlete, and there are some that are such a light touch that you could almost wonder, did that do anything? But yes, it's absolutely 100% safe. And every doctor of chiropractic is going to do an exam on the patient way before they ever touch the patient. And most of us take x-rays as well, whether or not not whether or not, but the x-rays give us a picture of what those bones look like on the inside. And, contrary to popular belief, we didn't all follow the anatomy textbook when we formed ourselves. There are some bones that are shaped funky, and if all you did was palpate them, you might think they need to be adjusted on one side, and in point of fact, the other side is the side that is mispositioned. So it's critically important that we know what we know and we adjust what needs to be adjusted. Not everything does, and less is usually more in the case of everyone's adjustments.
I guess I'd ask you who might be a good candidate for chiropractic care, and Dr. McCarley, it sounds like everybody's a good candidate.
Not actually everybody. You would think so on the surface, but really it's the people who want to take a proactive approach to their health. Not everyone is a good candidate for what we do in our office, because a lot of people will actually come in and want to be fixed, and that's really not what it's about. It's really about us partnering with them to be able to help them find solutions so that their body can do what it's supposed to do, which is heal and regulate itself and be as healthy as possible.
EPOC doctors, Mary Grace Pennella of Stillpoint Family Chiropractic, and also Dr. Brian McCarley of McCarley Chiropractic. Anything coming up like what you have done in the past, an event of sort of that you'd like to mention before we let you get out of here, Dr. Pennella?
We are actually in the planning throes for the next EPOC event that we're going to do, and it is scheduled for late July, and we are at the moment looking for our location that we're going to put it in. Boy, that library we used last time is a busy place. So, and the next one, the topic will be heart disease prevention. So
okay, and how can we reach both of you, Dr. Pennella?
Stillpoint Family Chiropractic can be reached at 317-863-0365 or on the web at www.drpennella.com.
And Dr. Brian McCarley of McCarley Chiropractic, how would we reach you?
Sure. We're at McCarley Chiropractic, a creating wellness center. We're in Noblesville at 565-1726. And our web address is www.savinglivesnow.com.
Thank you guys very much.
Our pleasure.
Thank you.
Our thanks to American Senior Communities. Have a great weekend. Up next, Home and Garden Show with Pat Sullivan and Dick Crum after Fox News on 93 WIBC.
Caring people make the difference at American Senior Communities. Click on the American Senior Communities logo or go to ascseniorcare.com for information about services, locations, and special stories of seniors.
Welcome back. This is Caregiver Crossing on 93 WIBC. Terry Stacy with you this morning. Well, in studio with me is a couple of doctors. EPOC doctors Mary Grace Pennella of Stillpoint Family Chiropractic and also Brian McCarley of McCarley Chiropractic. Hello, doctors.
Good morning.
Good morning.
Are you friends?
We are.
We are.
Well, thank you both for being here this Saturday morning. Creating Wellness Center hosted a free event last month at the Hamilton East Public Library, Fishers Branch. The event Conversations, Cutting Edge Cancer Prevention, gave attendees practical steps to take to minimize the risk of developing cancer. And we've got them here today to find out more information about EPOC, or do I call it EPOC?
EPOC, please.
Yes.
We call it EPOC. What is EPOC, Dr. Pennella?
EPOC stands for Educating the People of Our Community, but that's only one of its definitions. It is also a resource for chiropractors so that we can support one another in what we do.
Chiropractic practice has been around a long time. Dr. Pennella will continue with you for just a moment. How old is the chiropractic profession?
Well, in 1895, chiropractic was discovered in Davenport, Iowa. So we are 118 years old and counting. Would you like to know the birth date?
Well, yeah.
It is September 18th. We celebrate chiropractic's birthday in our office.
So it's been around a long, long, long time.
Mm-hmm. It is really amazing that the very first chiropractic adjustment wasn't for back pain or neck pain, which is what we're most closely associated with. The very first chiropractic adjustment was given to a gentleman named Harvey Lillard. The doc involved was Dr. D.D. Palmer. And Harvey Lillard was the entrepreneur who owned the janitorial service in Dr. Palmer's building. And they'd become friends. They were both business owners. And Harvey Lillard had been deaf for 17 years. He describes the incident as he bent over to pick something up, heard a pop, and then heard nothing for 17 years. And Dr. Palmer this particular day said, Harvey, let me check you out. And basically he, what we call palpated, but he ran his hands up and down Harvey's spine, and he found a lump, a bone out of place, if you will, and he ratcheted it back in place. And I use that word very carefully because if you see the bench that adjustment was performed on, ratcheted is a really good adjective. No padding at all.
It sounds scary.
Well, and I'm certain at that point in time, Harvey was a little taken aback. However, the next morning, Harvey reports that he heard the bells on the horse carts and his hearing came back.
Wow.
Yeah, big wow. And, at the time, they thought they found the cure for deafness, so they brought millions of people to him, to see if they could, have a similar miracle happen. But indeed, what he found was a healthcare revolution, if you will. D.D. postulated that the nervous system was in charge and in control of everything, and that when the nervous system was interfered with, that there would be consequences elsewhere in the body. And so that is what chiropractic is.
Very, very interesting. Never in all my 52 years of life did I know anything about it, the history, and I appreciate you sharing that with us this morning. Brian McCarley is here. Dr. McCarley of McCarley Chiropractic is with us as well. Doctor, we all suffer from back and neck pain, do we not? I mean, we really do.
A significant number of Americans will suffer with back pain throughout the course of their lives. In fact, it's been estimated about 80% will suffer some bout of back pain and neck pain throughout the course of their lives. And many seek conservative approaches to caring for that, as well as potentially medication, and hopefully they can avoid surgery.
Well, when you've got a back problem, a back pain of some sort, it takes you completely out of the game. It really does. It can take you down for a couple of days, and everybody knows the answer. You could just be talking to somebody in your building, and somebody says, "Oh, you need to lay flat on your back on this table," or you need to roll out of bed every morning to find out what the answer is. And for many of us, is it true, Dr. McCarley? We just live with it.
That's true, and it's unnecessary. In our office, we use the analogy of the check engine light on your car, and back pain is a great check engine light in that it tells your body that there's something going on, that there's a problem. What we find is when we examine people and evaluate their nervous system health, we find that, oftentimes there are reasons for that back pain, but there are other things going on as well, and as we develop a care plan for those folks, they see drastic changes in their health in other areas, not just in alleviating back pain.
For example, give us an example.
Great example, depression. We've seen depression improve in our office to the point where people have been able to reduce or eliminate their antidepressant medications. I've had several patients be able to reduce or eliminate their blood pressure medications. To be clear, that to say that chiropractic is a treatment for those conditions would be inaccurate. We don't treat for those conditions. What we do treat is the interference that's present in the nervous system that Dr. Pennella alluded to. And when that interference is cleared, then the body begins to heal from within and take care of all those other issues on its own.
Dr. Mary Grace Pennella of Stillpoint Family Chiropractic and Brian McCarley of McCarley Chiropractic are both here with us today. And Dr. Pennella, let me ask you, if you go to a chiropractor one time, does that mean you have to go to the rest of your life? You hear that sometimes. Once you start, you just keep going.
Oh, Terry, I'm so glad you mentioned the pink elephant in the room. I love that. In point of fact, what we tell folks is that chiropractic is really a lifestyle choice. And when you understand what will subluxate, and subluxate is the word for what we correct. We correct subluxations of the spine and nervous system.
Okay.
So the definition of subluxation is the nervous system is interfered with. And so we take away that interference, remove that subluxation so that the body can communicate with itself perfectly. So when you understand that the only cause of those subluxations is stress, stress wears many names, but only three principal names. There's chemical stress, physical stress, and emotional stress. Tell me something that we experience in this world that doesn't fall into that category.
Yeah,
one of those
true.
three categories. So when you understand what it is that will subluxate the body, the choice is, wouldn't I rather and wouldn't I be better off without the interference that a subluxation represents to the nervous system? And so with that in mind, I choose to get adjusted for the rest of my life. And it's always everybody's choice. But when you have the understanding, and that's really what Brian and I are about, is bringing that understanding to the public.
That is so interesting. We talk about stress and where we carry our stress. Or I have noticed as I'm getting older that when I have a really stressful day, that my lower back hurts. And I always assume it's because I'm not sitting correctly throughout that day as I'm working very hard. But it could very well be, you suppose. And again, you're not diagnosing what my problem is, but could it be that I'm carrying that stress in my lower back?
Most definitely. If you take a look at how Brian and I are sitting,
yes.
When you sit for the day, you really should only sit on the first third of the chair. Now, that's good advice for anybody who's sitting on a regular basis because you have to work at slouching. But there's no doubt that stress is parking itself wherever your weakest link is in your tissues.
Oh, I see people sitting on the big balls now. Mm-hmm. Is that's a good thing to sit on because they're keeping themselves straight by balancing themselves on those big yoga balls.
Plus, the other piece of that is they're exercising two tiny little spindles in the joints of the sacroiliac joint, and those spindles are what communicates to the brain where your body is in space. You have those spindles. They're called proprioceptive spindles. You have them in every joint of your body, and it's how your brain knows where your body is in space. And when we sit to the degree that in 2014, we all sit, we damage those spindles. Those spindles are taken offline a lot. So sitting on that ball or sitting on a balance disc while you're on a regular chair helps to keep the surface on level and helps keep sending signals to your brain where your hips are at any moment in time.
Do you suppose the way our placement is of our computers and looking at them all day long, do you suppose that is also affecting the way our backs feel?
Absolutely. Ergonomics is a huge portion of what goes on because we do things like repetitive stress, running a mouse. When we're looking at that screen and we're not looking at the screen at good eye level, you're tilting your neck and you're impacting how your neck goes. And you are a long lever, your neck right to your low back. So as your neck goes, so goes your low back.
Dr. Mary Grace Pennella of Stillpoint Family Chiropractic and Dr. Brian McCarley of McCarley Chiropractic. When we come back, we're going to talk about adjusting babies as we continue on Caregiver Crossing on 93 WIBC.